I'll bet you're just waiting to talk about abortion. And I'm going to start with something that's a fact. During the second trimester of fetal surgery, doctors may administer anesthesia to reduce pain experienced by the unborn. So, question, do you believe it should be routine to also give anesthesia to unborn children during late-term abortion to minimize the pain that they're capable of experiencing?
Senator, you're asking I know an important question, but a very technical question, and you're moving into an area which I know carries with it very deeply held beliefs, where folks sometimes have differences, and I respect that. I also want to make it clear that I respect the law and the science, and what I can tell you is that in my career of having worked to protect the health of all Americans, men, women, young, old, what I would do as Secretary is what I've done as the Attorney General of our state, and that is I would follow the law and expect others to follow the law. Yeah. And while we may not always see it the same way in terms of how we get there on a particular issue, I will tell you that on health care, these challenges we have to confront for the American people. So I would look forward to trying to reach that common ground with you and others.
Well, I appreciate that, and I think you made my question more complicated than I meant it to be. I wasn't asking you, were you for late-term abortions or not? I was asking about, during that process, whether or not you thought that the baby ought to have pain in the process of that, a painkiller in the process of that abortion, like we have a requirement for fetal surgery. So maybe you can't answer that question, but I didn't mean to get into whether or not you support late-term abortions or not.
And Senator, let me try to address that if I can more directly. It still might not be enough for you, but I tried to make clear that I would rely on the science and the experts as the Secretary of HHS to help us make decisions to the degree that the agency has any role in making some decisions related to that. I would rely on the science and the experts.
Okay, thank you. Now I want to go to something that the Chairman, Senator Wyden, and I worked together on and worked in good faith and arrived at quite a compromise, and it deals with the subject of prescription drugs. I believe Congress must pass something like what he and I worked out last year in a bipartisan way, because we have this 60-vote requirement, and I think it might be very difficult to get something through that would take 60 votes that some people in your political party are thinking about doing. And most of that deals with whether or not we're just going to put a cap on increase in drug prices as the best way to get to solving the high cost of prescription drugs, or whether we're going to have the government negotiate prices, which basically the government dictates prices. And also we have some letters from CBO over a long period of time that says that it really doesn't save money, where the Wyden-Grassley bill saves about $95 billion. So this is my question. Do you know if the Biden administration would be interested in enacting a bipartisan prescription drug pricing reform bill, like, for instance, what along the lines of what Wyden and I worked out, that actually saves the taxpayers' dollars and can get 60 votes in the United States Senate, and it'll be a lot easier to get up under a Schumer majority leader position than it was under a McConnell leadership position? Or do you think they want the alternative of trying to get something a lot stronger from the Democrat point of view along the lines of what I suggested?
Senator, you've asked a great question, which probably would be easier for me to answer if I were still a House member or a Senate member, because those negotiations really are up to you all. But I will tell you this, there's no doubt that President Biden wants to see us lower the price of prescription medicine, and he and his team, and if I'm fortunate to be part of that team, will be working with you on a bipartisan fashion to reach a solution. And I want to congratulate you and Chairman Wyden, for the work that you've done in the past to try to bring members together.
Got 1 second left. We passed a bill that I've been working on for 6 years, and you will be in a position to get the regulations and get it underway. It sets up an alternative program for rural hospitals, and it's called the Rural Emergency Hospital Program. And it would work this way. A critical access hospital would have the alternative. They wouldn't be forced to do this. This would be an alternative, that if they want to give up their residential beds and preserve the other things that hospitals would do, then they could do that. And it's my way of keeping, when there's only 4% occupancy in most of these critical access hospitals, and it's a very expensive thing for them to operate, will maintain rural health services short of residents' beds. So I don't know whether you know enough about the bill that we passed, but I think it's very critical. The American Hospital Association worked with us, the Iowa Hospital Association, and I'd like to get that thing up and running as fast as we could.
Senator, I know the time has expired, but let me just say, and we can follow up with this question, that I am absolutely looking forward to working with you on this. People often forget California, as big as it is, has some very large rural areas. And I was approached by many of our state legislators when I was trying to tackle the whole issue of hospital over-consolidation. You know, hospitals gobble each other up, and they said, you got to make sure you're very careful, because in some of our rural communities, there may be only one facility, and they may not have any choice if they're going to survive, but to have a major player come in and take them over. And so please make sure that you don't think that a rural facility, which is standing out there by itself, is just like all these other places in urban America. And so,
colleagues, we're just going to have to move on, and
I will follow up. But Senator, I look forward to working with you.
Thank you.
I thank the senator from Iowa, Senator Cantwell, and then Senator Thune.